If you've noticed that you no longer wake up with morning erections, it's important to know that this change can be closely related to your health. This is not a minor detail or something insignificant. In fact, the absence of these erections can be a sign that something is not functioning correctly in your body. My name is Ana Richi, and I'm a urologist. In this video, I will explain the 4 main causes that could be behind the lack of morning erections. We will discuss factors that affect hormone production, blood circulation, sleep quality, and even how stress can affect your performance. Everything will be explained clearly and directly so that you understand what is happening and how to take measures to recover your intimate health. Before continuing, make sure you are subscribed to the channel to access more videos with relevant information about health and sexual education. Don't forget to like if the content was useful to you, as this helps more people benefit from these tips. We want to know your opinion. Leave a comment with the number 1 if you found the topic interesting or 0 if you have suggestions for improvement. Your participation is very important. Many men worry when they notice that those morning erections no longer appear. It's common to hear questions like, "My penis no longer wakes up rigid. Is this normal? Is something wrong with me?" This concern is more common than it seems, but before getting alarmed, it is essential to understand the topic. Morning erections play a key role in the functioning of the male body. First, it is necessary to clarify something important. These erections are not related to the urge to urinate. Forget the idea that waking up with an erect penis only means that the bladder is full. The explanation is different and has to do directly with the vascular system. If you follow this channel, you already know that here we take sexual health seriously, and if you are new, welcome. Let's see how the erection process works. The mechanism is simple but impressive. The penis has 2 structures called corpora cavernosa, which act as chambers capable of filling with blood. When this happens, these chambers compress the veins, preventing blood from returning quickly. This blockage ensures a firm and longer-lasting erection. Understanding this process is the first step in taking care of your intimate health. If you are looking to improve your sex life and strengthen your relationship, discover my digital book, Rediscovering Intimacy: Healthy Sexuality After 60. This practical manual offers strategies to strengthen emotional bonds, face physical and emotional challenges, and rekindle connection and passion. To get your copy, access the link in the first pinned comment. It's your opportunity to transform your love life. The erection has nothing to do with a full bladder or the urge to urinate. In reality, everything happens due to the vascular system. During sleep, the body goes through cycles, and in one of them, known as REM sleep, important changes occur. REM, which stands for rapid eye movement, is the phase where dreams are most intense, but its function is not limited to that. In this period, the body releases hormones like testosterone and increases the production of nitric oxide, a substance that dilates blood vessels. With more testosterone circulating and relaxed blood vessels, blood flow to the penis increases, producing erections during the night. This process is natural and occurs several times throughout sleep, normally between 4 and 5 episodes. Waking up with an erection is an indicator that the body is functioning correctly and has gone through these hormonal cycles. It is a healthy physiological response and part of the body's balance. If these erections stop occurring, it may be a sign that something needs attention. The most important thing is to understand that everything is related to blood circulation and hormonal balance. By understanding that the erection depends on blood circulation, it's time to analyze what can interrupt these morning erections. A frequent cause is a decrease in testosterone production. This hormone is produced in the testicles and controlled by the pituitary gland. When something affects this process, such as problems in the testicles or the pituitary gland, testosterone levels can drop, reducing nighttime and morning erections. Another key factor is heart and blood vessel health. Since the erection depends on efficient blood flow, any problem that affects circulation can cause difficulties. A sedentary lifestyle, obesity, diabetes, uncontrolled high blood pressure, smoking, and even the accumulation of fatty plaques in the arteries can affect blood supply and, as a result, the ability to have erections. Sleep quality cannot be ignored when talking about sexual health. The REM phase, in which dreams occur, is fundamental for the production of testosterone and nitric oxide, a substance that relaxes blood vessels. This cycle lasts approximately 90 minutes, and to maintain hormonal and vascular balance, the ideal is to complete at least 4 cycles per night. If rest is insufficient, the body does not have time to go through these essential stages, which can affect morning erections. Poor sleep disrupts the body's balance. Short nights with few hours of rest alter hormone production and reduce the vasodilation peaks necessary for erections upon waking. To understand better, just remember moments of high stress, such as caring for young children, spending nights awake, or sleeping only 3 or 4 hours straight. This is enough to affect the quality of REM sleep and, consequently, sexual performance. However, there is a modern enemy that deserves attention: stress. We live in an accelerated world full of pressures and worries, which directly impact sexual health. High levels of stress and anxiety increase the production of cortisol and adrenaline, hormones that keep the body in a state of alert. The problem is that this internal tension makes it difficult to achieve the deep rest necessary to reach the REM phase. Without adequate sleep, the body loses the opportunity to produce testosterone and release nitric oxide, 2 essential elements for nighttime and morning erections. Therefore, if stress is not controlled, sleep quality decreases, and erections can disappear. High levels of adrenaline and cortisol, especially during moments of anxiety, directly affect sexual performance. This is precisely the point we are addressing here. We have already talked about some main reasons for the lack of morning erections, and of course, this topic deserves attention. If a man notices that they have stopped occurring, it may be a sign that something needs to be evaluated. But there is no reason to be alarmed. It is important to observe the whole picture. If sex life remains active, desire is present, and the body responds well, there is no reason to turn the absence of morning erections into a bigger problem than it really is. Sometimes, the body just needs time to balance itself. The most important thing is to pay attention to how you feel in your daily life. If you have energy, drive, and disposition for daily activities, there is no immediate reason to worry. Focus on taking care of your overall health, and if something seems out of the ordinary for a long time, consult a professional to evaluate the situation. In this video, we have explained the 4 main causes that could be behind the lack of morning erections. From decreased testosterone to circulatory problems, the effects of stress, and poor rest, all this directly influences male sexual health, especially after the age of 50. Now, I would like to know your opinion. Which factor caught your attention the most? The relationship between REM sleep and hormone production, or the impact of stress on sexual performance? Share your comments because your opinion is very important. If this content was useful to you, press like. Your support helps these recommendations reach more people who may be facing this situation. And if you want to continue learning about sexuality and male health, check out other videos on the channel. I'm sure you will find interesting topics to improve your quality of life. Now, let's delve deeper into each of these factors to provide a more comprehensive understanding of why morning erections might cease and what you can do about it. Testosterone is the primary male sex hormone and plays a crucial role in maintaining sexual health, including the occurrence of morning erections. As men age, testosterone levels naturally decline, which can lead to a reduction in sexual desire and performance. However, other factors can also contribute to low testosterone levels, such as certain medical conditions, medications, and lifestyle choices. For instance, conditions like hypogonadism, where the body doesn't produce enough testosterone, can significantly impact sexual health. Additionally, medications like opioids and steroids can interfere with hormone production. Lifestyle factors such as excessive alcohol consumption, poor diet, and lack of exercise can also contribute to hormonal imbalances. To address this, it's essential to maintain a healthy lifestyle. Regular exercise, particularly strength training and high-intensity interval training, HIIT, has been shown to boost testosterone levels. A balanced diet rich in essential nutrients like zinc, vitamin D, and healthy fats can also support hormone production. In some cases, hormone replacement therapy, HRT, may be recommended by a healthcare provider to restore testosterone levels to a healthy range. However, this should only be done under medical supervision, as improper use of HRT can lead to adverse effects. Erections are fundamentally a vascular event, meaning they rely heavily on healthy blood flow. Any condition that impairs blood circulation can affect the ability to achieve and maintain an erection. Cardiovascular diseases such as atherosclerosis, where arteries become clogged with fatty deposits, can restrict blood flow to the penis. High blood pressure, diabetes, and high cholesterol are also significant risk factors for erectile dysfunction, ED. These conditions can damage blood vessels and nerves, further complicating the issue. To improve cardiovascular health, it's crucial to adopt heart-healthy habits. Regular physical activity, such as aerobic exercises like walking, jogging, or swimming, can improve blood circulation and overall cardiovascular health. A diet low in saturated fats, trans fats, and cholesterol, and rich in fruits, vegetables, whole grains, and lean proteins, can help manage blood pressure and cholesterol levels. Quitting smoking is another critical step, as smoking damages blood vessels and reduces blood flow. Additionally, managing stress through relaxation techniques like meditation, yoga, or deep breathing exercises can also benefit cardiovascular health. Sleep is a vital component of overall health, and its impact on sexual health is often underestimated. During the REM phase of sleep, the body undergoes several processes that are essential for maintaining sexual function. This phase is when the body produces the majority of its testosterone and releases nitric oxide, both of which are crucial for achieving erections. Poor sleep quality or insufficient sleep can disrupt these processes, leading to a reduction in morning erections. To improve sleep quality, it's important to establish a consistent sleep routine. Going to bed and waking up at the same time every day can help regulate your body's internal clock. Creating a sleep-friendly environment, such as keeping the bedroom dark, quiet, and cool, can also promote better sleep. Avoiding stimulants like caffeine and nicotine close to bedtime, as well as limiting screen time before bed, can help you fall asleep more easily. If you suspect you have a sleep disorder, such as sleep apnea, it's important to seek medical advice. Sleep apnea, characterized by interrupted breathing during sleep, can significantly impact sleep quality and overall health. Stress is an inevitable part of life, but chronic stress can have a profound impact on sexual health. When the body is under stress, it produces higher levels of cortisol and adrenaline, which can interfere with the production of testosterone and nitric oxide. Additionally, stress can lead to poor sleep quality, creating a vicious cycle that further exacerbates sexual health issues. Managing stress is therefore crucial for maintaining sexual health. Techniques such as mindfulness meditation, progressive muscle relaxation, and deep breathing exercises can help reduce stress levels. Engaging in regular physical activity is another effective way to manage stress, as exercise releases endorphins, which are natural mood lifters. It's also important to make time for activities that you enjoy and that help you relax, whether that's reading, listening to music, or spending time with loved ones. If stress becomes overwhelming, seeking support from a mental health professional can be beneficial. Beyond the primary factors discussed, several lifestyle choices can influence the occurrence of morning erections. Alcohol consumption, for instance, can have a dual effect. While moderate alcohol consumption may have some cardiovascular benefits, excessive drinking can lead to erectile dysfunction by impairing the nervous system and reducing blood flow to the penis. Similarly, recreational drug use can have detrimental effects on sexual health. Maintaining a healthy weight is also important. Obesity is associated with a higher risk of erectile dysfunction, as it can lead to conditions like diabetes and cardiovascular disease, both of which can impair blood flow. A balanced diet and regular exercise can help manage weight and reduce the risk of these conditions. While occasional changes in morning erections are normal, persistent issues may warrant medical attention. If you notice a significant decline in the frequency or quality of morning erections, or if you experience other symptoms like low libido, fatigue, or difficulty achieving erections during sexual activity, it's important to consult a healthcare provider. They can perform a thorough evaluation, including blood tests to check hormone levels and other diagnostic tests to assess cardiovascular health. Based on the findings, they can recommend appropriate treatments, which may include lifestyle changes, medications, or other interventions. Morning erections are a natural and healthy part of male physiology, and their absence can be a sign that something is amiss in the body. By understanding the factors that influence morning erections, hormonal imbalances, cardiovascular health, sleep quality, and stress, you can take proactive steps to maintain your sexual health. Adopting a healthy lifestyle, managing stress, and seeking medical advice when necessary are all crucial components of this process. Remember, sexual health is an integral part of overall well-being, and taking care of it can lead to a more fulfilling and satisfying life. If you found this information helpful, please like and share this video to help others who may be facing similar issues. Don't forget to subscribe to the channel for more insights into health and sexual well-being. Your comments and feedback are always welcome, as they help us create content that is relevant and useful to you. Thank you for watching, and take care of your health.